Hello, I'm Dr. Anna Likas, State Epidemiologist and Director of the Division of Disease Control and Health Protection for the Florida Department of Health. Personal protection equipment, or PPE, in combination with other controls, serves to protect healthcare professionals from exposure to infectious diseases in their workplace. PPE creates a barrier between the healthcare provider and infectious materials. Under the Occupational Safety and Health Administration's General Duty Clause, PPE is required for any potential infectious disease exposure. Appropriate PPE must be provided by employers, and they must ensure that PPE is disposed of properly. If reusable, the item must be properly cleaned, repaired, and stored after use. The Centers for Disease Control and Prevention issues recommendations for the donning and doffing of PPE, which should be used to prevent exposure to infectious diseases. This video will cover these recommendations, as well as incorporating the recommendations from the Florida Department of Health. This video is not intended to be an all-encompassing guide for PPE. Please follow all established healthcare environment protocols. It is highly recommended that the donning and doffing of PPE be practiced in advance of actual use. There are 4 key points to remember about PPE use. First, don PPE before you have any contact with the patient, generally before entering the room. Assistance will be necessary to properly don the PPE. Once you have donned PPE, follow contact protocol carefully to prevent spread and contamination. When you have completed patient care, assistance with proper removal and the disinfection of the PPE is necessary. Removal must be performed carefully before it can be discarded in the biohazard waste bag. Finally, immediately wash hands with soap and water before going on to any other tasks. The personal protective equipment demonstrated in this video is for use in healthcare settings in a low-risk situation. For example, less than 1 hour encounters with a patient who is mildly ill, as is typical early in the course of the Ebola virus disease. This equipment includes an impervious coverall suit, an N95 mask, a plastic full-face shield, inner and outer nitrile gloves, impervious shoe covers that cover the lower leg, and the checklist for donning and doffing. An air purification respirator, or APR, can also be used. This single piece of equipment can replace the N95 mask and the face shield if desired. Remember, APRs cannot be used by individuals who wear glasses or have substantial facial hair, as a proper seal cannot be maintained, and fit testing of APRs must be done prior to use. Please note, any EPA-approved disinfectant that will kill non-envelope viruses such as norovirus is appropriate. For this video, bleach wipes will be used. It will be necessary to have a buddy observe you in donning the recommended PPE for low-risk patient care. Perform the following preparations with your buddy using the checklist. Staff will likely be in their usual work clothing. Take inventory and check that all equipment is in good condition and ready for use. Your buddy should take your vitals and record them. And remember to remove all jewelry and watches. Long hair should be pulled back and secured using a hairnet or a hairband. Hydrate with water. Wash your hands with soap and water or use hand sanitizer. Above all, the goal in using this PPE is that no skin will be exposed while caring for the patient. First, don the inner gloves. Then don the coverall suit and zip to mid-chest. Be sure the cuffs are over the inner gloves. Be seated and pull on the shoe cover booties. The N95 mask is then donned, as it will need to stay in place under the hood. Check for fit across the nose and cheeks. Pull the hood up over the head and zip the coverall suit fully. If any skin is still exposed, then an additional separate hood should be used. At this point, an optional outer apron can be donned and tied by your buddy. The full face shield should then be donned and adjusted for fit. The next step is to don the outer nitrile gloves, pulling the gloves over the cuffs of the overall. Taping the outer gloves to the cuffs is optional. With assistance, stretch to ensure the fit of the equipment and gloves by reaching up and over the head and to the left and right. If your gloves have moved, apply a tape to the outer gloves along the cuffs of the overall. Leave a tab on the tape for easy removal later. Record the time and complete the checklist of PPE with your buddy. Remember, while using PPE, keep gloved hands away from the face, avoid touching or adjusting the PPE, limit the surfaces and items you touch, and seek immediate assistance if any part of the gloves or coveralls become torn. The removal of PPE using the appropriate methods is critical to preventing an infection from occurring. In general, the outside and sleeves of the coverall suit, the outside of the additional hood, the full face shield, and the external gloves are considered contaminated, regardless of whether there is visible soil. The areas considered clean that can be touched when removing PPE include inside the gloves, inside of the coverall suit, and the inside of the additional hood. The recommended PPE removal sequence is as follows. Have your buddy in place with appropriate protective equipment to observe your doffing process. You will need a seat to complete the doffing. Using bleach wipes, clean the outer gloves. Then using bleach wipes and starting at the top, wipe the full face shield, the additional hood, and the coverall suit. Using bleach wipes, again clean the outer gloves. Remove the face shield, lifting up and to the front, and hand to your buddy for further disinfection. Using bleach wipes, again clean the outer gloves. Remove outer gloves and dispose of along with the bleach wipes in the biohazard bag. Use bleach wipes to clean the inner gloves. Then, grasping at the top of the head, gently pull the additional hood up and to the front, away from your head, and place the hood into the biohazard bag. Then use bleach wipes to clean the inner gloves again. Now unzip and carefully remove the coverall suit, starting with the neckline, folding and rolling inside out away from the body to the ankles. Be careful that your gloved hands touch only the inside of the suit. While seated, continue to roll the suit away, taking the outer shoe cover booties away with the coverall suit, away from your shoes, and place them into the biohazard bag. Bleach wipe the inner gloves again. Remove the N95 mask and place in the biohazard bag. Bleach wipe the inner gloves again. Slowly remove the inner gloves using the glove and glove technique and place into the biohazard bag. Use hand sanitizer immediately, followed by hand washing with soap and water. Take and record your vitals. Be sure to rehydrate and record the time on the checklist. Hand hygiene is an essential infection control practice to protect patients, visitors, and other healthcare personnel. Again, it is highly recommended that the donning and doffing of PPE be practiced in advance of actual use. The CDC has recommended the National Clinicians Post-Exposure Prophylaxis Hotline, or PEP line. This hotline provides clinicians with 24-hour guidance on managing occupational exposures to bloodborne pathogens. For phone consultation, please call the number shown below. Thank you for your attention to these important guidelines.